Hello and welcome to our Health Science 314 lecture presentation. It's about preventive care, reducing healthcare costs, and empowering patients. And my name is Mitchell Silberberg.
My name is Aden Amare.
My name is Enxhi Papa.
And before we begin, I just wanted to set a scene. The sound of crunching leaves fills the air. Fresh grass, Gatorade, and sweat reach your nose as you finish your first lap around the pond. You struggle to catch your breath, having not exercised in years. Physical activity, a good health behavior, is commonly prescribed as a prevention method for various chronic diseases. It is needed now more than ever. Our research question for this presentation was how to encourage healthcare providers to promote preventive apps, technologies, programs, and care to patients to reduce costs. Now to Enxhi.
So I'm going to start with the problem. The problem is that 90% of the annual $3.5 trillion spent on American healthcare costs goes toward treating chronic conditions. And healthcare services usage and spending is higher among these patients, explaining the surprising statistic. Public health initiatives whose focus is prevention, they only received 2.64% of the national healthcare budget in 2014. By promoting the implementation of preventive care, culture, and technology amongst healthcare providers, it helps reduce administrative costs while also resulting in better health outcomes overall.
Now to the first major topic, preventive care. But what is preventive care? To someone who doesn't know about it from public health, what is it and are there different kinds? So preventive care, prevention, is the upstream perspective of handling diseases or health conditions and how they develop. It can be used in a clinical or public health setting. And there are actually three kinds: primary, secondary, and tertiary prevention. Primary prevention is the stopping of the onset of disease or conditions, such as with dieting, exercise, water fluoridation, aspirin usage, or vaccination. Secondary prevention is the detection of disease to stop the emergence of symptoms or minimize further complications, such as with psychological, metabolic, cancer, or even infectious disease screenings like with COVID-19. Tertiary prevention is the palliative reduction of disability, limiting complications and returning function. Some examples are physical therapy or rehab. Now for the intersection between primary and preventive care. So preventable causes of death, such as with tobacco smoking, poor diet, physical inactivity, and the misuse of alcohol, have been estimated to be responsible for over 900,000 deaths annually, nearly 40% of total yearly mortality in the United States. Screenings, counseling, and vaccination forms of prevention save lives at low cost or save cost over time. So routine primary care with the usage of preventive care will save cost, money over time, and is a better distribution of medical and monetary resources than simple emergency room usage. Most often, preventive care saves money, and even when it doesn't, it is the same amount as normal treatments, the health benefits outweigh the cost. Now, with screenings, they're extremely important. For example, HIV screenings were found to be highly cost-effective even in low prevalence populations. This allows for the start of treatment, reduces further transmission, proves to policymakers that HIV screening programs should be supported. Also, with immunizations and vaccination, these are needed as well. The WHO established in 1974, after the eradication of smallpox worldwide, that children should be vaccinated with 6 different vaccine-preventable diseases, such as tuberculosis and measles. And this list has grown since then. These vaccines' costs are far smaller than those of the actual treatment of the diseases if these diseases developed. Now on to Enxhi.
So I'm going to talk a little bit about fitness trackers and empowering patients. A little bit statistics. Nearly 45% of all Americans suffer from at least one chronic disease. In over 70% of Americans with hypertension, blood pressure is very poorly controlled. And we often don't realize how hard it is for people with chronic conditions, such as heart disease, obesity, and other preventable conditions to change. Change is possible, however. Imagine a 12 to 13-point reduction in systolic blood pressure. It can reduce heart attack risk by 21% and stroke risk by 37%. And only a heart attack costs around $80,000 in the first 90 days. The estimated annual healthcare costs of obesity-related illness are at nearly 21% of annual medical spending in the United States. Next slide. Patient engagement is really important. One way to engage patients into monitoring their own health is if the insurance companies provide them with a fitness tracker. Eligibility will be determined by certain criteria such as age, specific chronic conditions such as obesity and hypertension. Primary care physicians play a great role in an individual's life. They should encourage their patients to maintain a healthy lifestyle. By tackling this very matter, the routine proposal of fitness tracker in the outpatient setting could have immense outcomes in reducing national healthcare costs. It will keep people healthier and will lower our insurance company costs. Next slide. So what are these mobile fitness tracker? Let's take Fitbit, for instance. Fitbit is a fitness tracker that monitors in accurate and real time a patient's health stats. This accelerometer translates movement into digital measurements by measuring a patient's movement, distance they traveled, sleep quality, and calorie intake. It can help prevent obesity. Therefore, it becomes of great interest not only for the direct benefits to patient health, but also for the indirect benefits to the healthcare system and to the economy. In addition to possibly improving the outpatient management of chronic conditions, mobile fitness trackers such as Fitbit may put a halt in rising national healthcare costs. And we naturally think, has this been implemented by other insurance companies before we adopt it to our own company? Well, different health insurance such as United Healthcare has implemented this idea into their own program. The program is called Motion, and it's an employer program to incentivize participants to get moving. Through United Healthcare, employees can receive mobile trackers to monitor their own health. This is a way to have people participate in maintaining their own health and also reduce their health insurance costs. They are also offering patients Fitbit based on some criteria. It works best on patients that suffer from a chronic disease, as I mentioned, like obesity, not to all of them. Next slide. As we can see here, Motion is a program that was implemented by United Healthcare, and they statistics is that they lower the high cholesterol by 7%, heart disease by 9%, and diabetes by 12%. This is huge because we can save a lot of money in our insurance companies if the patient doesn't go very often to the doctor and maintain their own health. And also to motivate the patients, they have offered incentives. What are these incentives? These incentives are cash financial rewards to patients. For instance, there are certain exercises one needs to complete a day to earn the financial reward. And then the cash incentive pushes a lot of people to complete their daily exercise. Next slide. Some of the benefits of offering fitness tracker is that the ability to motivate people to change their behavior towards a healthier lifestyle. Second, it will help health insurance save a lot of money in the long run and lower their monthly premium if people go less frequently to the doctor. It also motivates other people to be healthier by creating a better and a sustainable environment. By creating a better communication web, healthcare providers will not need to do as many repetitive labs and diagnostics since the fitness tracker keeps track for them. Thank you.
So I will be talking about creating a culture that empowers employees to partake in wellness effort and preventative treatment. Next slide. Like we said, healthcare cost is a matter that we as a nation should take seriously and come up with plans that will reduce this huge cost. And I will give you an example of the Safeway model. Safeway followed the policy of health reengineering, where the company gave individuals more control of their health dollar by focusing on prevention than treatment. Some of the ways they increased their policy was by providing $800 in rebate on health insurance premium for an employee who remains within the common risk factors, for example, smoking, obesity, blood pressure, and cholesterol. Next slide. They also give access to gym-owned membership and free lunch at the company cafeteria for every visit to the gym. Furthermore, they subsidize the cafeteria, which offers a lot more vegan fare, portion size, calorie count, cholesterol, and fiber count posted for all prepared meals in the cafeteria. Next slide, please. How to apply the Safeway model on the healthcare costs. By building a culture where their employees take positive action towards living a healthy lifestyle and by providing the tools necessary to make those decisions easy, they were able to have healthier employees that seek less medical care. Next slide. In much same way, healthcare providers can apply similar programs that would focus on giving individual insurers control of their own health dollars. One solution is giving insurance premium discount to insurers who get regular physical checkup once a year and do not practice high risk factor. And thank you for listening.
Thank you.
Thank you.
Thank you.